devices here real time. Check this out. Awesome. All right. Awesome. All right. And then I'll show you about these specific devices here. So you've got new product launch exclusive to selected packages and offers. So new arrival. So you got the brand new PMF BioForge. Okay. So now this is, as you can see here, it's got 8 internal magnetic coils. In our competitors, we have available only in package offers, which is awesome. So this is incredible. Actually, all of the devices are incredible, and you'll see here that we've got the dual lights, right? So then you've got the red near infrared light in it as well. It's 633, 660, 850, and 1064. And then you've got the shorter periods of time that you can do it for when you've got the hour handy, the 30 minutes. But because, like I mentioned about the benefits that happen when you can sleep on these devices, it's profound. Okay. So we've got a 9-hour timer on this, and there's no one that's doing this. They don't exist anywhere. And so it will fluctuate. So it'll take you through different frequencies as you sleep and push you in the delta wave, and then also push you to wake up. Okay. And then it's using the high 150 millitesla that you saw in the previous study in terms of the magnetic field strength, which is a big thing to look for. Most devices as well, only 3 coils. We've got 8 coils. So which means that most of that device is all lit up with PEMF, with the red light and near infrared light and far infrared heat therapy. So it's like a sauna, red light, and PEMF all in one. Okay, so very profound, only one of its kind, and surprisingly incredibly affordable, which is really, like, it ranks around that $1,300 in this package. A lot of these items are all priced below $1,000, and even like $900 or so forth. You just do the math on each one of them, and you realize how cost effective everything is there. So that's the Ultimate Spectrum package. It's 30% off, and then you use the code Valentine30, but it'll be automatically applied. It's the Pro 300 Max, which is the device that's behind me here. The 200, which I picked up before. I'll show you those. PMF. I'll show that right now. Okay. Okay. So this is the 300. So you can see that. So as you can see, it could cover all my organs. Then the 200, so you can see it's reasonably smaller, but not a lot, it's not a tiny device, and it's still covering most of my organs, right? And then also the flexibility of having something that you can hold in your hands and move around. And I'll ironically often have this on behind me with my shirt off, sitting on this chair. And I can show you more of the functionality of this here in a second. Yeah, may as well do that right now. Okay, so I'm plugging this in here. I'm going to show you guys what this looks like here. Controlling this. Okay, so now I could choose modes here, and then I could go to all, which is going to push the blue into it. And then I could go over to just red, near infrared, yellow. Now I could go to red and yellow, and you look at how bright that goes. Then we go to red and near infrared. We go to near infrared and yellow. We could go to red only, yellow only. We could go to near infrared. We can go to blue only. And so there you have it. You know, the only, you know, full spectrum device on the market. And then I could also choose scenes, and I could go, okay, I'm going to choose the customized setting for fat loss, customized setting for sleep. And then when you look at this and you say, I feel really confused, then it's simple. Just do all wavelengths. When you've got your eyes open, instead, you would then take out the blue, which is by taking the red out, the blue out by doing red, near infrared, and yellow. So brilliant, super irradiant, super powerful and wonderful device, and you know, only one of its kind. And like I mentioned, like, I mean, that cast iron build, the reason why it's got 50,000 rated lifespan hours is because of the quality of the build, which means it's designed actually for a lifetime of use, literally a lifetime. With a whole family using it, you would expect around specifically around, let's say, 80 years of expected use. So what you're doing here is you're choosing a therapy to have in your home for life. And then there was somebody in the chat that, you know, asked about a competitor, Juve, and like there is a big difference, right? So you've only got a few wavelengths there. The irradiance is nowhere near as high. They're not using a lot of the most advanced technology. And maybe that's because they got like a lot of their marketing budget is going into, a lot of their budget's going to marketing or something like that. I don't know. I don't want to criticize. They're not bad. I'd even say they're good, but this is great. And there's a reason why, you know, people like Tony Jimenez for the Hope for Cancer Center, he could go and use Juve, but why is he using ours, right? There's a reason for it. And there is a superior product that you're getting here. So then you've seen that, the PMF mat, I'll show that in a video, but you can see here, this is actually, so it's full body, which is great, head to toe. And that's that. And if you're overweight, there's nobody I've ever, you know, seen that doesn't fit in that, because you could fit 2 humans on that if they were head to toe, and you'd be fully within the mat still. Average sized humans like my wife and I, we'd go head to toe. I'm 5'9", and I'm broad shouldered. Okay, so advanced spectrum package, so 30% off, and you see the price there. Pro 300, Pro Belt, Pro Mask, Cap, Knee Device, Hand Device, PMF BioForge, docu-series, and then the free extras. Okay, so really great package there. And all of these can be done on payment plans as well, or you could just go outright. Core spectrum package, 30% off here. Big saving, by the way. So you're saving there $1,700 on that package, and on this package $2,100, which is, you know, nice big savings there, which is great. $1,200 saved on this one, which is the Pro 200, the mask, the belt, the cap, and the sauna blanket. And then you got the docu-series and the supplements free. These other packages come with the free stand. The previous ones here come with the free stand. Free stands here as well with these, which is great. Okay, so which can be another, you know, $300+ there. So the Pro 300 Max, this is very popular. All of the packages are very popular. This is an example of a really popular one, like our BioForge package here, or the Ultimate Spectrum package that has the BioForge mat, very popular. And here coming over to, you've got the Ara Pro 300 Max. Again, all of these devices all have the 9 wavelengths. I'm going to go through the irradiance of each one. Free extras built for daily use. Then now here's the power density tested independently with meters, just like I did with this. And we're doing US testing and US owned, US designed and US testing. And you've got here 288 dual chips. So it's a total of 576. You've got all of the wavelengths. So it's 480, 590. You saw it on the chart before, 590, 630, 660, 670, 810, 830, 850, and 1060. So all 9 wavelengths are there in all of the devices. It's a 3-year warranty. And so you can see that in the colors. So when you saw those colors before, you saw all the different wavelengths in action. So that's how that all goes together. and that's at 3 inches. It's got the 205. Now the Pro 300 panel, again, very popular because it's such a good, they're all really great value, but like you look at how cost effective that is for a device that's going to cover generally all your organs. It's just not as wide as the 300. So definitely worth the 300 max, that is, sorry. So definitely worth the extra investment, and to get the belt and the stand, which will also go horizontal. So the stand that you saw this on will go horizontal, which is, this one here is just a vertical stand only, but here you've got a horizontal stand that comes, or vertical. It's up to you. So you can change it at any time and continue changing it as you wish. So the radiance here is 195 milliwatts at 3 inches. And then you can see the rest. It's 216 dual chips, so 432. And then you've got here the Pro 300 here as at 1200. Soon. We'll down to the pool. Remember, Daddy's on this call. You got to close the door, boys. No, you got to go out. You got to go out. Okay, love you, boys. Love you. Okay, and then you got the docu-series, the free extras, the supplements. Like I mentioned, this was one that my grandma on my wife's side of Wella, she's used to regain mobility, right? So it's, you choose what is within your budget or what you can make work. And some people, like, they're like, oh, I wish I had got the bigger package. The other thing, I would never feel regret as well, because whatever you get, then if you ever did then get something else in 6 months, a year, 2 years, 5 years, then you have the power. Like, for example, with somebody that had the Juve, one, you could either use that in combination if you got another device with us, or you could gift your Juve to somebody, and you're not giving them something that's not working. I believe that they'll get success with it, right? And then you can then someone you really care about that you want to have abundant health, and then get that. Or some of you guys will get a full package there, and then you'll get something that's for your parents, something for yourself. And like my dad, $30,000 from my money spent on his knees for stem cells, didn't work. He just texted me again today. He's like, thank you so much. This is like helping me so much for my knees. So Red Light has transformed his health and transformed his knees, which is just amazing. So 144 dual chips, which is 288 LEDs, light emitting diodes, non-flicker, etc. 3-year warranty. 3-year warranty with all the panels. High power, flicker free, low EMF, or zero technically. Just short of 800 there, saving close to 300, and got a 25% off discount on all of these. 192, so it's still very high radiance, even though it's a smaller device. That's what that looks like there. All right, so you can see that, and its stand is inbuilt for the like tabletop, right? So I could kind of sit here working and have it shining on me there. Okay, so you've got the door hook, the pulley system, protective glasses. That all comes with all of them. Precision cap. This is an example of that right here. And you can see all the LEDs in there, so I could turn that on. But I'll just keep moving here. Got a nice saving there. And I'll just breeze through these. And you got the irradiance listed there. You got the precision mask. You got the irradiance listed there. The wavelengths is 415, which is the blue, 630, 850. 6 modes, which is red, blue, near infrared, red plus blue, red plus near infrared. 1-year warranty. Therapy belt here. Just, like Dee, she's an example, right? 9 out of 10 pain score, sciatica, back pain. Quit a full-time work, part-time work as a massage therapist, $48,000 a year salary, reclaimed it. Why? Because she went to a 0 out of 10 pain score. What did she use? This, right? So anyone's like, oh man, I can't afford, full device or something like that. Then don't feel like there's not a place for you. There's no one that couldn't afford this, I believe, that's watching this, because if you did this on a payment plan over 6 months or 12 months, you could be paying $30 or something like that a month. And then you could use that, and your whole family could use that, and you could all be getting red light treatment, and then you could be liberal with it. You could have it in multiple sections of the body to then constitute a full body treatment. And so there's always ways to play. And then you've got the red and near infrared. You've got the knee device here. You've got the 60 light emitting diodes, and perfect for knees. We've seen people use this for their shoulders as well. And you've got the hand glove here. And then you've got the new arrival of the Pro mask, which is a laser device, and it's 50 milliwatts of power. And then the Redlife Pro belt. And so there you've got the 236 light emitting diodes, 460, 665 nanometers, 850 and 1064. So red, blue, and 2 in the near infrared spectrum. And it's amazing. Like I feel like you feel your skin like being activated and healing, and you end up looking like you're from the old show Mortal Kombat. Red, blue, near infrared, 2 different modes there, and 4 wavelengths, flicker free, 0 EMFs coming out of that. And then you've got the Pro belt, nice saving there with this. And then you've got the power density listed here. And then you've got the 4 wavelengths, 5, 630, 660, 810, 830, and 1060. So they're the wavelengths. It's very customizable with the touchscreen. And so these testimonials have been really mind-blowing here, where it's like, look, I've been using this product for over a month now. The quality of the panels exceeded my expectations. I enjoy the comfort, quality product, works as described, great quality product, superior quality, love the bracket, very nice to be mounted, etc. So, but the transformations become the thing that really makes it clear to people. We had somebody that had, she'd been bedridden because of this issue with her Graves' disease, a hyperactive thyroid. She's gone back to swimming, cycling, and it's just been a wonderful thing to see this woman. She ended up competing in the New York Marathon 2.5 weeks after treatment, after being bedridden. So that's Shannon, her name. And so I
had this horrible fall, got a horrible tear.
We've documented a lot of case studies, and you're going to see some of these here, right? Check this out.
On the muscles holding my rotator cuff, both in the front and the back. And when I say excruciating, I'm telling you, it really was. There was no comfortable position. Finally, when my red light unit came, I do 20 minutes in front and 20 minutes in back. And I'm telling you, I have just minuscule pain.
Hey there, it's Jonathan Otto with Red Life. This is something really special that everyone needs to know about. What's that? Red light therapy. It's a game changer. It's something that's so unique, so powerful. It is so effective that it's just changing people's lives around the world. Check this out.
This therapy light increases mitochondria and increases ATP production. So not only do they come back, they have the energy they used to have.
I noticed my waist 2 notches back down on my belt in about 10 days. It's really been amazing.
Oh my gosh, the sleeping. I sleep like a baby now, and I cannot tell you how fabulous I feel, and I shouldn't be feeling this good.
I've been doing my red light since January 1st. With my acne, it was like I was a 16-year-old teenager. It's all gone.
It's a real solution, and these are double-blinded placebo studies where they give even people fake lights. People don't get better on the fake lights. They most often get worse because conditions progress over time, and that's what's happening. So it's not a placebo effect. If it were, the placebo studies would show that people do well in the placebo studies as well, but they don't.
I had Bell palsy along with macular degeneration of the eyes and stuff. I'm 92. I'm going to be 93.
Oh, wow. You look fabulous.
And it really, really, where I can see things around me, on the side, where before I couldn't. The red light. Yeah. Boy, it's helped a lot.
If you can get light into the cells, and once you harness the energy production of the cells, you look at something like the Birmingham University study where they irradiate the rats with 1 minute of light per day for 5 days, they find a 45% increase in cell viability. So cells are 45% more effective at performing functions. There was a spinal cord injury study in mice. It was regenerative of the spine and it was neuroprotective of the brain, even a minute of exposure. Surprising, but amazing.
And then my neighbor has a dog that could not walk. 14 years old, and so I let her use the small panel, the small little one,
Yep.
And she told me after 5 days, the dog was pretty much running around the block.
To be able to see him go out and eat is even a miracle. And you just tell him thank you. I'd like to say thank you to him. But just tell him thank you, that I really, really love him, and tell him he's doing God's work.
What sets our Redlife devices apart? Advanced dual chip LED technology for maximum power and coverage. All models feature dual chip LEDs, effectively doubling the output per LED. Covers a wide range of wavelengths, 480 to 1060 for skin, muscle, and deep tissue benefits. Customizable experience with precision control. Touchscreen interface and Bluetooth app control for seamless operation. Mounting options, versatile accessories for wall or ceiling placement. FDA Class 2 approved, fully FDA registered and manufactured to the highest standards in our FDA registered factory. Premium build and long-term investment. FDA Class 2 certified device, low EMF, high power, flicker free.
And I've got an old golf injury in my right elbow. I don't know if I've got arthritis going on or what, but it's been super painful. I started wrapping it by day 4. This thing is just awesome now. I mean, there's just no pain in the elbow anymore. In fact, called my son. I was like, dude, let's go bowling again. We haven't been doing that for a while.
I'm excited.
You understand it, William. That's awesome. I can, and I think that excitement is well-founded. We're seeing people get their lives back, William, and it's just awesome. Yes, that's really inspirational. Even for me watching that, because look, it's about us. It's about us all getting our lives back. Are you still undecided? You got a 30-day, 60-day money-back guarantee, 3-year warranty, 1-year warranty, 3-year warranty for the panels, 1-year warranty for precision devices, free shipping with the United States. That's huge, and international. It's not a large cost. We're taking a lot of that off, but there's a cost there. But you can buy now, pay later, and that's 6, 12, or even 24 months, or 4 payments over 6 weeks. And so you can just make it work for you, interest-free for the paying for, and it ends up being a great way. International after pay, US only for the PayPal. Congratulations on showing a genuine interest in your own health and your wellness by boosting your body's vitality. We have something special for you. You have now access to these incredible masterclasses, this book and recipe book, Understanding Silent Symptoms, Early Signs of Cancer, 11-module masterclass, Feed the Body, Starve the Cancer, and Thriving with Plants Recipe Guide to Health and Healing. And the symptoms, Silent Symptoms, is an 11-module masterclass. So it's great value. Don't miss out on this life-changing opportunity. Offer ends February 8th, 2026, 11:59 p.m. Eastern. And I've just made that available offer now. So check that out on the screen. I've just published that. So you could just click on that. And you can then follow that instruction there. I'll show you what that looks like here. And I just click on View Offer, where that shows up on your screen. And then you can scroll down the page. We'll have the video, the replay up the top of this page. And then you can scroll down and you've got the Valentine's Day special there. And there we have it. All right, so we're going to go into questions. So click on the offer. And remember, guys, something that's really important to know, that we've got a lot of people, like thousands of people that got invited to this, and we'll get the replay. And so we have limited inventory because of we're a small company. So as 100,000 people get an invitation to watch this replay, and thousands of orders come through, then we have the issue of selling out. And then that just means that it means that, you know, you can kind of miss that opportunity. And so take advantage of that and understand that those demands come with a small company. It's available. And as you get emails and reminders, it means that it's available. So make sure to grab it as it's available. Make sure to grab it between now and when we close it on Sunday night. You get all the discounts, bonuses, free gifts, everything. Yes, Florence says, do we only get the free gifts if we order by Sunday? Correct. Sharon says, J.O., awesome webinar. Thank you so much. Love the family interruptions. Yeah, nice. Thank you. Agnet, just got the Redlife PMF, Matt. Okay. Karen, Heather, and neuropathy. Agnet, do you have the PMF mat in your home, or are you waiting for it? Let me know. Heather, using the belt on different areas, 20 minutes each on the neuropathy, how many times on the mat? Darlene, do you know of anyone with trigeminal neuralgia being helped? Yeah, we've covered this actually. So I'm going to go into the question and answer, and and Sharon is the winner of the the Redlife belt, which is this. So Sharon, congratulations. You're in the chat there. Oh, there you go, Sharon. There you go. No correlation to you giving a compliment there, okay? So this is, look at that. Look at that bright irradiance. Beautiful. So that's coming out to you as a gift. Yes, the mat has infrared light, correct. Both both red light, near infrared light, and far infrared, not mid infrared, but red, near infrared, and far infrared. Specifically at 633, 660, 850, and 1064. So that's the red and near infrared spectrum. Sharon says, yay, thank you so much. You're welcome. Okay. Okay, awesome. All right. So now, Karen, will with you, if she's facing that, I'd get her to watch this because the belt will be helpful, but it'd be really wise for her to look at that. And then if she makes the purchase herself, she's going to be more likely to use it. And that's going to be like a really critical aspect there. Protocol for the belt to work with women's period cramps. Yes. We'll go through that. Let's just pull this up. Let me see what we got here. We are in action now. Let's go through the question and answers. We'll take about 25 minutes here, all right? So just so you can budget time. Sharon, I have wet macular degeneration. Does this help reverse this condition? Red light therapy may help wet-related macular degeneration by improving how retinal cells make energy. Okay, cool. One thing I wanted to quickly say, okay, when you're making an assessment and you're looking at what something costs, okay, this supplement here, okay? Doesn't matter which company, whatever, okay? So this supplement, okay, if this costs me $50 a month, okay, I order it every month. That's $600 for the year, okay? 2 years, $1,200, okay? At the end of that 2 years, I don't have it anymore, okay? So it's only valuable for the time that I have it. And now I'm a family of 4, so let's times that by 4 for us all using this supplement. Obviously, my kids matter more than me, okay? So then I would be up for $2,400 a year for this one single supplement. Now, over the next 10 years, that's $24,000. Now, does it make sense, for example, to invest $5,000 into a package that has everything that if you span that out over the 10 years, and then that's just 10 years. I just use that. Like I didn't choose like 30 years, which would be, hopefully you'll live another 30 years. I plan to live more than that. But, you know, I might have another 80 years of life by God's grace. Okay. So now let's say 30 years. Now you're at like what, 70, 75, 73,000 or something like that. Right. So it's just crazy to think about what the immense benefit that will come as a result of using these therapies and how cost effective it is, so that it becomes like every time you use it, it's like the price of a single strawberry or a single, not even an apple or whatever. And so you've got a huge tool in your arsenal to like score in all these different areas, anti-aging, you know, the money you're spending on hair products and for skin products and for oral health, because you get it even opening your mouth, letting it get your gums, over the groin area, the erectile dysfunction, you know, Viagra, whatever. I'm just, you know, like, look at the research in all these categories and see what it does for all of these different things. And then you realize, wow, this is helping the thyroid medication. Yes, do I believe, is there evidence? Is there clinical study showing people getting off thyroid medication? Very common. In fact, with the right use of it over time, it should happen. Like, only 5 weeks in one study, 47% with chronic autoimmune thyroiditis got off their medication. Over only 5 weeks, 47% got off their thyroid medication completely. Zero. Everyone had reduction. Okay, so by reduction, like if you halved your medication dose, then you've halved that cost monthly, and then you've improved your function. By the time you're off it, then you've regained that. So let's say you're spending $50 a month on that. Maybe it's $100 a month on your thyroid medication. Now you're off that. Look at what you saved over the next 10 years. You saved, for one person, you know, like $6,000 if it was $50 a month. So that's one condition, right? Then what about eyesight prescription? You could correct your eyesight completely, so you don't need glasses anymore. So now you don't need to keep getting glass prescription. So this is the way out. So arguably you're not spending anything. You're actually saving everything, right? So wet macular degeneration, will this help reverse condition? Red light therapy may help with wet age-related macular degeneration by improving how retinal cells make energy and calming the inflammation of the eye. Red or near-infrared light penetrates eye tissue and is absorbed by the cell's mitochondria, helping it work more efficiently. This can support stressed retinal cells, reduce oxidative stress, and lower harmful inflammation that contributes to leaky blood vessels, swelling and bleeding as seen in wet age-related macular degeneration. Early studies such as this, and this is the clinical study backing this here. Here it is here, showing exactly what we're talking about here. Suggests that this therapy may help reduce retinal swelling and bleeding and improve visual function, all without heat damage or invasive procedures. Linda, can red light therapy help with non-Hodgkin's lymphoma? Red light therapy may help in some cases of non-Hodgkin's lymphoma, which it affects the skin based on good clinical evidence, which is a form of lymphoma, remember? So you got cutaneous lymphoma, non-Hodgkin's lymphoma, and I'm not saying they're the same. They're obviously both blood related, and there's a clinical study backing this here. And here's the research on that. When used as photodynamic therapy, a light sensitizing cream is applied to the lymphoma skin lesion first, because cancerous lymphoma cells absorb more of this cream than normal skin. Red light is then applied. It activates the cream and produces reactive skin molecules that selectively target and kill lymphoma cells without heat or surgery. Studies and reviews show how high clearance rates in early stage cutaneous lymphoma with fewer side effects and excellent cosmetic outcomes compared to radiation and chemotherapy. This treatment is non-invasive, repeatable, and well tolerated, and is mainly effective for early superficial skin lesions, not lymphoma deep inside the body. It's important also, which would be then methylene blue and then red light and near infrared over the bones and over longer periods of time, meaning that daily over the period of months and even years. Not that shouldn't necessarily take years to put a condition in remission, but should be continually used, just like we're encouraging everyone to use it. Okay, so you can read more there. You can screenshot all these answers. Melinda, I've heard great things about methylene combined with red light therapy. Do you agree? Okay, so yes, I do. There's real science behind this. It's active, and here's the clinical study showing this. Pairing this reduced tumor sizes across multiple cancer models, including melanoma and carcinomas. In some cases, worked even better when advanced delivery methods were used. The results are promising and biologically plausible. Here's the clinical study there. Methylene blue helps against different types of cancer, including colorectal tumor, carcinoma, and melanoma. Yep, so you can see that there. Here's the title of the study. And then, okay, what I'm going to show you right now is I'm going to go into grok.com. I'm going to share this here. So now, just to kind of accelerate this, we would go to show me how to use red light therapy for the top 10 most common cancers. What great clinical studies back these findings, the time frame of success. You can just copy and paste what I'm writing, screenshot it, of success, the time to use the photosensitizer used, the time to take it before red light, how NIR, near infrared, and how long to use it for, what time frame to expect a result, other combinations in to use with other different therapies in combination, to use in a table, do the same with the top 10 autoimmune conditions with columns, give links to all studies, use the best results available and most compelling results with most positive outcomes. Okay, there we go. I'm going to copy and paste that into the chat here as well. We're going to let that go to work here. Let's see how that works. Oh yeah, and I didn't say what wavelengths to use. And that's really important. So I'm going to stop that. I'm going to say again, what specific wavelengths. Also show me PEMF for the same in a separate table with columns. Do the same for sauna with far infrared heat. All right, it can get to work here. Yay. Okay, let's come back to that. You guys are seeing it working. Okay. And it doesn't mean that everything that comes out there is the gospel. It doesn't mean we can't push it further. It doesn't mean anything, certainly. But if those studies and we verify them, then it does mean it, unless, you know, there's conflict of interest or something there. But remember, these are kind of quite combative to the cancer industry. So, you know, they've got pretty tight parameters. Okay, so yes, methylene blue and red light therapy, real science behind this. It's available, such and such. Yeah, we saw that. And then there's the clinical study there. Nancy, where can I find how many OHMS for different parts of the body? When looking at red light therapy guidelines, the key factors aren't electrical measurements like OHMs, but clinical dosing parameters that determine how much therapeutic light actually reaches the tissue. The most important things to focus on are wavelengths, typically the red and infrared range of 630 to 850, the irradiance or power density measured in milliwatts per centimeter squared, and the total fluence or energy dose delivered measured in joules per centimeter squared. Equally important are the session length and treatment frequency, since superficial skin goals usually require different timing and dosing then deeper targets like muscles, joints, and nerves. Melinda, my dad has lung cancer using your red light. He's using your red light device. How long, which setting, how much, and how close to the chest? For supportive use, have him use red plus near infrared light on Redlife 660, 850, which would be all wavelengths generally from 480, 590, 630, 660, 670, 810, 830, 850, 1060. Start with 10 to 15 minutes per session, 3 to 5 times per week, keeping it 15 to 30 centimeters. So what I'm going to say is generally, I'm still saying like 3 inches is better than this again, but this is a very conservative thing that will also give this. Use a moderate intensity, so you could push it back to 50 to 70%. I'm still just saying, look, I'd go hard and fast. Personally, I would be using it at 30 minutes a day, generally, yeah, the reason why we're advocating, for example, here for something like urine therapy is that there's a lot of science on this. It was published in all the medical journals, not all, but like Oxford Symposium, Nature, Science Magazine, Nature Magazine, early 1900s, British Medical Journal as well. And it was showing that it was used for all different types of cancer and was extremely effective in clinical studies. Okay, so really important to note there. And so here, this is going to give you more specific answers here. Okay, so here's its listing here, the top most common cancer types. So we just even dealt with that with lung. Again, now here you've got the ranking here. Here's the top 10 most common, and now here we're going red light therapy. Here's the panel. Links to studies, that is blank. Maybe there's something happening with, there we go. No, okay, it's pushed back there. Copy table. Let's just make sure that I can. Okay. So there's studies aren't showing up in this, but which is something is making that glitch out. And then in this one here, fix this with the links to studies. Photosensitizer. So these, then you would say, okay, photofrin and this hematoporphyrin derivative. Say, okay, what if I substitute this for methylene blue? And I'll ask those questions. So there's the studies that it's linking to. So it just glitched out on that, but it's expecting results in that 1 to 3 month period. 630 nanometer light is there, but then you could push this further and you'll find that near infrared is very important and effective. So it's just showing you some of them. And because it's going with photodynamic therapy, it's why it's kind of resorted to the wavelengths that activate those photosensitizers, largely speaking. So breast cancer shows promise in reducing resistance, recurrence, fatigue, how to use high level. So you see all these, and then the time periods to expect, and then it's time to take the supplement before 24 to 48 hours for those ones, but 3 to 6 hours. And the methylene blue is 30 to 60 minutes. And some of these you may not be able to get a hold of. And then can I use methyl? Add this to the table. Okay. And they'll show that, and then you say, well, I'm not going to just ask a search engine whether I can do this. I'm going to ask for studies, and that's what makes that powerful. Okay, so, and then you see this. Yeah, so not necessarily used for autoimmune conditions per se, but add methylene blue to the table. Okay, so here we go. Want to see breast, colorectal, prostate. There's all these, yes, apoptosis cancer cells, PDT. These are the studies on these for stomach, liver, 36 months. And then I'm gonna even just share this. This will, I believe, share everything I just put in, and I'm dropping that into the chat here. You should be able to just click on that, guys, and see, because that enables me to share that immediately. Let's see, it's put it into a table here. Yep. So it's just substituted, added in like methylene blue as a substitute, and then some of these, and then you just ask, look, general methylene blue review systematic. There's the review of studies then with methylene blue, and the backing on that. Let's go here. And this here is using methylene blue. See, look, it's here, right? So, and the reason why I say that is that then you go, like, the one I'd recommend is actually the methylene blue from a company called Earth Harmony. Okay, so which is a like, it's part of the Global Healing Company with Dr. Ed Group. They use a nano gold and silver, and you'll see even more studies on that being used in combination. And they do have a supplement form. The reason why I'd even say use the supplement form if it's internal use is I would say use that instead, because it won't make your tongue blue. But then the liquid form is good to have for anything topical. People are using it for their gums and for healing, for oral, related. So the liquid can be good as well. It also could be used as a rectal suppository, and that's another way to do it. Okay. Here we go. Yep, you see it all here. Pancreas. And so it's even telling you methylene blue limited. So it's telling you, okay, we don't have a lot on this. And then it's like not giving you, or like, direct studies, for example, for that one. But you could push it further and you'd be able to find some things. But like look at how much I ended up with this. Isn't this awesome, guys? You guys, it's like amazing and so helpful. And it's like, and then you could work together with your doctor, especially if it's a functional medicine, holistic therapist, etc. But this information, some of you guys, I'm really, conscious about some of the, challenges in this model of education, but just notice how powerful this is to give like real information to even the doctors that you're working with. If you're working with doctors, best evidence, most compelling, breast, selective mass death, lung apoptosis enhancement, colorectal tumor reduction combo system up to 99%. So that was especially in those types. Wavelengths, there you go. Home clinical devices often 660 nanometers will work. So you've got that. And then we went for, this is with the photodynamic therapy. And I said, show me a table with columns or PEMF and sauna with the top 10 cancers and top 10 autoimmune conditions. Okay. And so no photosensitizer used for that, right? So light sensitive. Oh, well, it's not going nice and fast for me now. It's ready to go. Okay. Lung. So this is showing PMF key findings. And then now it's how to use positive outcomes, key evidence, time frame, how to use high level positive outcomes, show me, add to the table, how long to use for, daily or weekly, and time of the day. What else? That'll do for now. I'll skip selection. You can choose for me, buddy. Okay. And these PMF references, I say, make the references, make the evidence links clickable, hyperlinked. Okay, ready? Let's go. Here you've got for the cancer cases, morning, early afternoon. Did I get time in the day here? It might not have even given us time in the day, did it? Oh, yeah. Oh, well, yeah, that was there. Let's go. Okay. Time to take specific wavelengths, time to expect a result. And then you could also just put in a column for the time in the day. Okay. So coming down here again, let's go. And it's giving morning. It's given the amount of time, 20 to 40 minutes daily, 5 to 7 days a week. And so then you see a common thread as well. And that kind of just helps and makes it a little bit more like you got a general understanding. And then sauna is generally going, like a lot of them are pushing towards evening, which is interesting. And maybe that's partly because it can exhaust you, which can be a good thing. So you've exhausted yourself, now you go to sleep, right? So there's evidence of that. And you could just even say, like, show me the evidence for the evening. Guys, is this helpful? Are you guys enjoying this? Is this cool? Or is this like, oh, I hate this? You cracked me up when you were sensitive to the temperature of the H2O. I can't remember. That's funny. Oh, was I saying it was too cold when I was on stage? James, okay, Redlife pulse. Pulse frequencies, yes. Correct. Like we let everything pulse, even though it's not a general recommendation I do. Oh, yes. Don't forget to update. Yes, guys. Tell me whether you're having a success with clicking on those hyperlinks. And where did my screen go for that? This one. Here we go. And here we go. Sharing this again. And it helps because what I'm going to do is now I'm going to share this document, but then instead of me just now reading this, I'm able to give like better information. So Gary, okay, we're going to do like another 7 minutes here and then it's a wrap. And so what I'm going to do is like just hold it on these and then I'm going to ask the question, then say yes. And then a lot of those specifics, it's going to be better to kind of read that yourself and then also push it further as well. Okay, so sorry, I'm back in now. We have the mat and the red light device. Not sure how to use it. Okay, here's a simple, safe way to use it. And then you've got the amount of time there. And look, daily use, I'm an advocate for it. So for everyone, 30 minutes a day, every day. Whatever time in the day you can do it. Ideally, first thing in the morning. 15 minutes either side of the day, right? Sunrise, sunset. Go to bed, right? So like, which would be a total of 30 minutes per day. That's generally a thing. Then you can go to like, while you're acute, you could see if you do well in it, 30 minutes twice a day. And then if you've got the red light and PMF, do them both at the same time. Lie the device horizontal, be 3 inches away. But then we've also got some more conservative parameters. We call this the med bed hack. Okay, so people that have researched that know what I'm talking about. Red light therapy, do you have to remove all your clothes? yes, for red light, but near infrared will go through the clothing. And so meaning that therefore, because you're going to do red at the same time, then yeah, sure. But if you're just using like a sports bra and you know, some shorts, something like that, then you're still going to get so much benefit. And if that makes you be able to use it versus not because you're in some like area, like in the living room with family members or something like that, then do that. And you not being a perfectionist about it will get you better results in the end. And then, so big benefits there. Cindy, I'm thankful for my earlier panels. Fixed my issues. That's amazing. Wondered how to help my stenitis. If you don't mind sharing your email, Cindy, and Cindy, would you email anyone that's in this chat that has got results? Please just let me know that yes, we could use your story. Belinda says, I've learned to make my AI requests much more intense, right? Your life is based on the quality of the questions you ask in general, let alone with using the mysteries of the internet and the power of every published clinical study that exists on the internet. And if anyone thinks that AI or something like that is like the devil, well, it's not actually artificial intelligence. It's actually programmed intelligence, and very much like it's really, I'm just using it as a search engine. So just be aware of that. And I'm just getting it to table out things for me. And, and this is how we found, not necessarily AI, just the power of search engine allowed us to be able to find the things. And then with me connecting the dots and understanding things, I've then become a powerful like leader in that. Okay. Awesome. Jen, okay, awesome. No, you won't be talking to somebody. Even if your credit score is low, you should still pass on that. And yeah, sorry to hear that. I get it. Look, I think everyone here knows what it's like to go through some hard things here. So my heart goes out to you. And just see what happens when you check out with that, and whether it just flies, because at the end of the day, it's quite unique to that system. Like in this case, PayPal largely. And but yeah, like just see how you go with that. Like anyone, please, if you've got results, drop it in the chat and drop us your email and say, yes, I'd be happy to share my story. Drop your email and I'll reach out to you, my team, and then I'd love to have you attend like a call with us where you can share your story like you saw the other ones, because they are so helpful. Hyperlinks work fantastic. So great. So, and that's grok.com. You guys can all do the same thing in Grok. And I do have a paid version, but the free version might and arguably would do the exact same thing and not be necessarily any different. And ChatGPT or Manus might work just as good or better. I've used that. I found it helpful. Yeah, sure, you could do every nefarious thing with AI and make some pornographic requests or something like that. I guess, I don't know, but you wouldn't use it for good, and it's a powerful tool. So red light can help with sinus congestion and allergic rhinitis. Here's a study backing that here. Okay, great study on that. And then let's come back here again. And then you could see that there, like the fake non-light treatment didn't make a difference, but the red light did. Really great for nasal flow, works by calming inflammation. Okay, Sharon, I use infrared sauna. What's the difference between red light? Far infrared heat therapy works well with heating the body, works well for various things, but it doesn't interface with the mitochondria directly. It's indirect. Light therapies are going to really stimulate the mitochondria to produce energy, ATP. Then that will detoxify through the energy aspect. Heat therapies will detoxify, like far infrared will detoxify through sweat and through heat by raising the core body temperature, increasing the immune system. Different opinions about macular degeneration. We've seen amazing success. I've seen, mid 90-year-olds get back their eyesight from having severe macular degeneration, and complete restoration of peripheral vision. I know that's not always associated necessarily with macular degeneration. Just remember, these are all names for degeneration, and your eyes are part of your brain exposed. Your brain has the highest concentration of mitochondria, In some ways, if it's a brain-related issue or eye-related issue, they're the easiest. Just like you see with cutaneous B-cell lymphomas, because it's exposed, it's easier to treat. The same thing is true. So just screenshot this. Big breakthrough studies with photobiomodulation. Heather. Select all is generally great. And here's the wavelengths again. You can see them all listed here in our device. All of our red light panels have all those wavelengths. The PEMF mat has the red and near infrared, which is 633, 660, 850, and 1064. And they're dual lights. So it's 72 lights complete. And it's full body still, even though it's the reason why it's good to get a red light panel with it is because there is a much higher concentration of lights in the red light panels. And so then that becomes perfect. But if you just had a PEMF mat with the red light, it will give some, amazing benefits. So Terry started using the panel. Yeah, I guess you can screenshot that. The studies that combine red light and PEMF together do outrank and either therapy alone. And they're done with androgenic alopecia and with periarthritis as two of many or several examples. And then you just use your logic to take the results from the PEMF on the prostate cancer as an example, and then the red light for PEMF. And then you go, okay, let's see what these clearly work. There's no detrimental impacts. The studies that combine them don't show detrimental impacts. They show enhancing impacts. So then you've got like a system there to go with. Okay. 30 minutes a day, only 3 minutes of eyes. Great. I would do 3 minutes in the eyes. I do more. I do actually like 30 minutes, eyes open, straight in, close to the panel, which does mean I'm pushing it further than the studies, but I'm also showing that it's not an issue by doing that on myself, and many others are doing the same, but I'm not saying that everyone should do that. People could do that. Yeah, eye treatments once a week is recommended. Yes, but sunrise and sunsets are there daily. Sun gazing, and which is sunrise, sunsets. I believe historically you'll find people doing that daily. The once a week really is just showing what they did, but what happens is it will keep kind of resetting each time. So I would personally do that daily. And the 3 minutes or 45 minutes, if it's for eyesight, it doesn't make a difference. And both will result on average, if you're over 40, in that study, 17% in eyesight improvement within the same 24-hour period, so quite immediately. But it had to be the morning, so it can't be the afternoon. It has to be the morning, and so that's you see our research there. So that's the clinical study backing that finding here, guys. I did say wrap it, so I guess this is it, and that study is kind of taking a while to go. So you can find that study by using those keywords. Gary, DMSO, you can then see more about it. Maddie, lung health. Here's the Redlife 300 Pro Max would still be a strong recommendation for everyone because it's the device that is the largest available there, and it covers like your whole torso, all your organs, head to groin area, and all your organs for the width. And so therefore it becomes the kind of go-to device. And then you'll see the packages, the bigger packages are built around it. But then if your budget is more limited, then you're going to do really well with just using the smaller devices, even if it's just the RL Pro 100 or the 200. That's no small feat. That's a huge and powerful tool that is world class and medical grade. So you can see more of the protocols there. Terry, 7 Pro Belt. Why don't you use pulsing? So you can see more of the information there. And you're not missing out if you don't do pulsing. Continuous mode already delivers strong therapeutic benefits. Pulsing is an optional tool. You can experiment if it feels good and suits your goals better. It's believed that it pushes things deeper. It was based on the findings around lasers that they had to pulse them because of the overheating issue. But then it became believed that it was delivering higher. And so that's why we've included it. And if any emerging research comes out that makes us feel like that's a better option, to me, it's also not available in nature. You don't see that in nature. So hence why I gravitate that. But I would still let studies trump that. Pulsing is often, as you saw, was not a factor that was assessed in these, but you could push the AI tools as well to ask more and then experiment and see like 1 week to the next whether there was an improvement and see how you do with that. Okay, so then there's the answer for you, Dorothy. Is there infrared? Near infrared is when the lights are flashing. No, solid red is red light. No, near infrared is it's invisible. So the reason, this is all dual light. So you've got two different lights coming out of each light source. All of them are shining, or almost all of them are shining, with the exception of the blue, the near infrared. So that's why you've got the red and near infrared. Oh, that's a beautiful picture, Asher. Did you draw this? Yeah, it's wonderful. He's jumping up and down. You want me to come out now and play with you, right? It's time, isn't it? Should we go to the pool? Or what?
Yes.
Okay, cool. You give me 5 minutes and I'll be out. 5 minutes. You're just gonna stay here? Okay. Oh man, why are you so cute? Okay. Okay, there you go, Maddie. Can you do red light through clothing? Yeah, here's how. Mela Paz, can I use red light therapy with a pacemaker? Yes, it is safe. Okay. And Elizabeth, is there info on how long to use it for prostate cancer? I have the red light belt. Okay. And you would look then at the research, and so to give you a better answer, just keep pushing the studies, but then you can always improve on the studies by, to me, this is my subjective opinion, that by replicating nature, because sometimes it was based on parameters that, like, how often could those people come in and the ability to carry out the study. So they didn't necessarily do it because it would be optimal, though likely often that was a big part of what they were trying to do. But they also had to do what was feasible. When you have a red light device in your home, you could push it to the extent by which you see red light twice a day. Okay, it's pretty obvious. We're designed for both. You know why? Because it's telling the body, we're awake now, and then red light, we're about to go to sleep. It's for sunset, right? So it's very clear, and then that's going to cause you to sleep deeper. So that's why you would use it in the morning and in the evening. The blue actually is also going to say you're awake now too, because the blue light comes out as well, all right? Once the sun goes from the red sunrise, and then during the day, there's predominantly blue light. Okay, red light help with blood conditions. Okay, yes, it is. But microscopic red cells found in organs, yes. Here's the clinical studies backing this finding here. You can use that link, go look at the studies. Mary, what about using castor oil while using red light therapy? Yes, many people are combining it. Great combination. Apply a thin layer a bit before your session. Keep your device clean. Always listen to your body. So Florence, is applying a photosensitizer agent before using red light therapy necessary results? No, it's not. So, and in fact, I generally don't use it. Because we're doing a lot with cancer, then I would say generally, yes, if you can, it's just going to make that treatment better. But generally, it's not a necessary tool. And methylene blue, I wouldn't use it every day if you didn't have a condition. I would use it for a time while you have the condition, that put it in remission, and then I'd use it periodically, maybe a few times a month, maybe once a week. And you just have to kind of feel into that, do your own research. Kathy, my husband has Parkinson's. Where would you direct the light? What frequency? I'd put it straight into his eyes personally. And around his head and brain, and then over his gut. And so all organ, head to groin area, eyes open, red, like eyes open, then blue has to come out. And but then you can see this, like, cause like you'll see here with my team and I, we're putting together research. Like we're also making things really conservative, 5 to 10 minutes per area, 3 to 5 times per week. That becomes more accessible than me saying twice a day, every day, right? So I'm giving you a spectrum intentionally, because some people, like, you're at home and all you're thinking about is getting better, and all your day is built around that, and you actually want to use it more. And so I'm giving you the prescription for that, and then I'm giving you the prescription for not that way. Can red light and PMF therapies? Yes, and that's the best. The combination of those therapies, from my research, is the best. And in nature, that's exactly what you see. You see the earth and the light at the same time always. But you've got about 40 times the strength of the sun with a red light device, and you've got about 1 million times the amplitude with a PMF device, and a similar amount in the magnetic field strength, that much more, like 150 millitesla versus 0.00005 millitesla for the Earth's magnetic field. So big difference, which is why there's an accelerated result, and that's why these studies, Andrew Huberman and others have said, like, sunlight can be better than red light. It's not actually true based on all these studies. If you compare, you'll see that there's many benefits to the sun, and you'll get vitamin D from the sun, which you won't get from red and near infrared light. You would get that 293 light, if that was in there. But then if we put that in there, we'd also cause you to have to be further away from the device, and you'd have to really limit your session time. So it would damage the treatment in that sense. Yeah. Sorry, guys. Oh, yeah. All right. I'll be out 2 minutes now. It's important. Good. Oh, that's so cute. Okay, Paul, how do you treat a sinus infection and ear infection at the same time? There you go. We got a way to do that. Kirk, for general whole body health, I guess the large panels are best. Yes. Correct. And then there's your answer there. Laura, I'm sensitive to bright lights. It's difficult to look directly into the lights. Any suggestions? You don't need to directly look into. Closing your eyes will still get through the eyelids. Okay. And then glasses, eyes open, you're still going to get through the glasses, which arguably glasses with eyes open looking into it, probably even better than eyes closed through the eyelid. But I don't know, I don't know for sure which one would, because there's not going to be a study on that. Let's do a study with eyes open versus glasses. Like, there's lots of combinations, and you could run that through ChatGPT, and it could run scenarios and saying, okay, well, what's that made out of? Okay, it's okay, it's going to diminish the penetration by X amount. And anyway, look, guys, some of these will end up making it so complicated we'll feel a hesitation. Just use it, and just do whatever feels good and works okay and fits into your day. And like, drinking water is like not a science, right? Let's not make red light a science either, even though it is. Hey, Jackie. And sure, drinking water is a science, but we haven't made it like that. I don't actually think we should make it like this. But we have opportunities, and we're solving problems, etc. Infrared spa with dry heat is very beneficial. Penetrates the body. People would prefer dry heat because of this, such and such. Whiplash. Stay short. Whiplash, would rather, yes, of course. It's amazing. Like, here's shoulder and neck disability comprehensive review. Great study on that. Meldon, red light product for treating prostate cancer. Yes. Red light belt is okay. Yes. But I would still use the full body panel. I'd be it's not just a localized issue. And that's what I think people miss with cancer. I think that we should be getting red light over all the body. We should be improving all of our organ function, because then all of that support of the enhanced organ function, because mitochondria are in all your organ cells and your bone cells. So by fueling that, you're fueling the healthy production of your whole body. And so it knows that you have cancer. Okay. Your body knows, and in the prostate. And so then it's going to go for that issue better, and your organs and your whole body is going to support the treatment of that cancer. Your bones are producing the stem cells. So just think about, you got to look at treating the bones. And this is part of the reason why PMF is known as a bone therapy. Why we're using it for cancer, because it's producing new stem cells in the bones. So there's this whole stem cell pursuit of understanding how both red light and PMF are going to stimulate the bones to produce new stem cells and help those mature. And therefore you've got a very powerful therapy for your health. And then there's the answer to that, Melvin. Pat, here's the answer for, yes, the pro belt does, and the other belt, the non-pro belt doesn't, but the irradiance is slightly higher. So there's a case that's good for both of them. And so that's a good answer there. Belt is used for all areas of the body. Yes, absolutely. Even the eyes, which I use it for. I can't really give that recommendation other than the fact that saying that that's what I do. And you could strap it on your knees, your back, your shoulder, your everywhere over the organs. And it then becomes very accessible. Guys, this has been fun. Did this help you? Did you enjoy this? I hope so. And here we go. It's a wrap. Oh, okay. It was staying on that screen for a while. My apologies. Did it? How long was it there? Darn it. Okay, I'm going to go back here because I was telling people to research the document. Okay, screen share, this one. Okay, I'm going to go back over these so you've got them. Okay, where did that drop off? I think it was, okay, so you'll see all the answers here. And so you'll send out the document, but the key is, even just during this, you screenshot the answer to your question. Great. Did I not go up high enough? Just in case I didn't, I'm going to scroll over this. Remember, you can just pause this at any time once it's on yours. It's just using the pausing function. Okay. Melinda, dad has lung cancer. Yes, it's supportive. Florence, great one. Gary, there's the answer. Marie, answer. Cindy, answer. Sharon, answer. Gary, there's your answer. Heather, yeah, all wavelengths, great. Terry, there's your answer. Gary, there's your answer on DMSO. Maddie, there's your answer. Terry, Probelt, Dorothy, Maddie, Ma De La Paz, Elizabeth, red light, blood conditions, Mary, Florence, husband with Parkinson's, and that's where we got up to. So there we go, guys. Thank you, and sorry about that. Guys, it's been great. It's been fun. Bless you guys, and thank you for your time. Yeah, please change your screen. When did you say that? Let me see when you said that. Okay, thanks for telling me that. Okay, God bless, and we'll be in touch. Remember as well, guys, go click on the offer while it's available. Remember, the knowledge won't do anything unless you apply it. There aren't any companies that are out specking us and outranking us for the quality of the products, and then we're competitive with the prices and a lot cheaper than a lot of the companies. And then it's not a race to the bottom where we're like, some of the stuff that is like out there, you don't know whether it's just a flickering light or it's just a gimmick or not. So you've got to kind of trust the company, and it's got to be forward facing, and that they have to stand behind what they're doing. And people in your community are getting results, like without us asking, people are writing about the results that they've got. So guys, it doesn't do anything unless you apply it. Use the knowledge to your benefit and get the result. And I encourage you, let's do this, and let's see your health transform. And I believe in you. I know that you can get through what is in front of you. Guys, if you've enjoyed this, please send some love in the chat for the team, especially for everyone that was involved in making this happen. It's a huge feat, and it's a labor of love. And so it's a blessing to be with you. Thank you so much. And yes, we could save this PDF, but I can't drop it in here as that. And so easiest might be there, but I believe the team will email it out to you guys. But the answers, particularly in my methodology of teaching you guys, then became the best tool. And then I am excited to be a part of that revolution of educating people to the greatest levels and extents in this field. Guys, like I'm saying, knowledge doesn't do anything for you. When you apply it, it does. Get some products in your home that will make a difference. Just know as well that when you get your products, you'll be using them for life. So, when a product might take a little bit longer to come, but still has a time frame that it will get to you. And we stand by that. You can interface with our team. We do question and answer sessions like this regularly. And then you're getting that support, and then it's without devices, which means that if you have another device, we're happy, because I want everyone to get results, but I don't know exactly how to know whether that's going to give you the benefit. And I hope it will, but having that surety and that confidence and using the systems that we have then become the powerful tool to get this done. And that's the reason why Dan Pompa, with his program, people pay out that $8,000 to be in that program. I'm the guy that's helping with all the red light and training the doctors and the holistic health coaches, and coming on to do that with Josh Axe's team. And so we're giving all that knowledge and those tools to those practitioners so they can best use them, and then they can stand by those results. And so we're leading that conversation. We're helping people get the most profound results. And so it makes it a no-brainer, like an easy decision. Let's do this. Let's get this. And then covering you with a 60-day money back guarantee. So it means that you can try it now and you end up deciding later, okay, was this everything I hoped for? Was this everything that I thought it would be? And then Gary, that's amazing. I've been using the map 6-4, and maybe you mean 6 weeks, and I've had unbelievable results. You've got to tell me about it. Please, could you drop your email? I would love, actually, I can get your email. I can get it here, and I can save the chat. Okay. Here we go. Thank you for that. Okay, guys, God bless you. Here we are wrapping up. I certainly didn't ask him to say this. I'm so excited that I'm getting that. And anyone else, guys, if you had any results, just tell us, because we do have your email there. And It's really just so awesome that we can, okay, bless you guys. And by the way, okay, guys, get ready. This is, like I saved the best for last. Did you enjoy this, and would you like to recommend this to friends and family? We do have an affiliate program now that will refer 6 levels deep. And so you have to think about it. How do we get our products to people? How do we, because we don't want to associate with like big pharma and all these things. What we do want is to empower people and to like take care of you guys so that you can take time to educate people and change people's lives and then be taken care of. The Bible actually even says every workman is due of their labor. So when you share that, there's a commission there that you can get that you deserve that allows us to get that to people that are good, caring people versus big networks that don't care, that would easily sponsor Pfizer. And we don't want to, we don't want that. What we care, even though that's fine. Like I could justify advertising on a network if I believe in what I'm doing, but what do I prefer? Doing that with you guys. I just started, I hope to have amazing results soon. Great. Feels great. Oh, that's awesome. Send me results. So all you do is just respond to any of our emails and just say, hey, I'd love to be an affiliate. And then we can get you set up there. And it means that you can refer a few people. If any of those become like big influencers, then you'll get tagged for everything that they refer or anyone else that you refer. So it, like, obviously you're familiar with network marketing. This is not that in that it's 6 levels versus unlimited, but it really allows then you to incentivize to share with others that could then share with others. And then you could help a lot of people. Mary says, I'll start using my Pro Max 300. Good for you. 6 months, no, 6 levels, which means that you have, this is going to cut out any second now. So God bless, which means that when you refer someone, they refer someone, you get credited for that down 6 levels, meaning that you can make a really great living and be taken care of by just getting this amazing device to people. Gary says the mat has reduced my pain level to a bearable amount. And it sounds like it was a short period of time, which means that I would see that you're on the pathway to no pain. I don't know that for a fact, but I believe that based on like an early result does indicate to me a profound transformation that awaits you. God bless. This has been so much fun. Respond to our emails to join us and refer this to other people. And what about the UK? Yes, we ship to the UK and internationally. God bless you. 6 months. Got it. Okay, great. Got it. 6 months. Great. And that's still a short period of time. So bless you. Sue, thank you. Can't wait to continue and support you and bless you. And, like I said, get started. Make sure you take action before midnight on Sunday, coming up this Sunday. We don't want you to miss out on all the discounts, gifts, and bonuses. And I'll catch you really soon, and make sure to do so before we sell out as well. So catch you guys. We'll be in touch.